Do you want my name? Well, I'm Zara. I'm 13. I went into care when I was 12.
I'm Lara. I'm 13 years old and I went in care when I was 9 years old.
My name's Orla. I'm 15. I went into care when I was 14.
When I went in foster care, I was a bit nervous and worried.
I was actually there when you turned up.
Yeah.
Remember?
Yeah.
Yeah. The foster carer had phoned me to say, I think you might know this girl that's coming in, and could you be there when she turns up? I was like, yes, absolutely, because I knew that you'd be scared.
At the time I was just like, well, it's going to happen anyway. And then when I got there, I was quite shy. Then I got angry because they weren't my parents. I was like, well, you can't tell me what to do.
I think one of the things that we know about many children that become looked after are the biggest health need that they have is around mental and emotional health need. This has usually come from quite a long and chronic period of stress within a family as they've tried really hard to cope with the difficulties that they have. But the impact on a child as they grow up is that very often they don't understand those stresses and that they just absorb them, and that in absorbing them they become mentally distressed.
Yeah, it was quite traumatic. You were like a rabbit in the headlights, weren't you? Yeah. But we could ask lots of questions about what are the rules here, how would you get your stuff from your nannies to your foster placement.
To be honest, I'm feeling much better about it. I feel more, sounds bad when I say it, but I feel more safe.
I felt a bit nervous because I didn't really know them well enough. I didn't know who was staying there. I didn't know what the rules were. And
don't be scared to be talking to them, to talk to them, what's on your mind, or what you're feeling. Because it can really help, because if you're getting it off your mind, then that just helps you just really relax, really, because you're not worrying or just stressing over something.
And there's always someone that's going through the same thing in the same house, so you can talk to someone in the house.
I've been settled in and I know nearly half the foster parents that I've been in, and I quite like it in care.
I think it's really important for young people to get a sense that the professionals that are around them, and there are a lot of professionals around them and they may feel overwhelmed at that, and I think it's really important that the young person gets a sense that the professionals actually do understand that the experience of being looked after is overwhelming, it's anxiety provoking, and also that it's not a judgmental process, that actually being looked after is not placing a judgment on either the family or the young person. It's not a punishment to them.
I'm closer to family, because I normally just didn't really care, but now I do care about more things, and I'm starting to go to school, which I never went before I was in care.
Some of the young people that we support, lack confidence, lack self-esteem, and require some level of support from the service to be able to make and maintain their own appointments. That can include, mental health services or appointments with GP or sexual health services.
I think some of the most challenging things around the health for children that are moving into care are that very often they're not placed in the same area or locality that they've grown up. The impact to that in their health is that they are away from the core health services that have known them and know all about their health and have been able to provide good care for them throughout their childhood. Things like their case records don't get transferred very easily.
Many are leaving care placements where they've had 24-hour support, whether that's been through the foster carer being around or within the residential placement or their kinship carer being around. When young people move on, there won't be that same level of support, so they need to have a network around them to be able to support them, and we work with young people to develop those networks.
When I grow up, I want to be a personal trainer.
Well, I've had thoughts. I don't know. I want to be a beautician. My mum's actually talked to one of her friends about me going into the shop and doing some things.
I want to foster kids with disabilities when I'm older. Get my own flat when I'm out of care. Then go on holiday.